most of the patients of heart failure, those who are having already heart failure, they tend to hospitalize, the number of hospitalization increase during winter. We should know the amplitude of the problem. The magnitude of the problem is that almost 30% of all global deaths are due to cardiovascular disease. And they follow a seasonal pattern proven by many studies that they tend to increase during winters, and one has to be very careful about it. All the kinds of cardiac diseases, cardiovascular diseases like acute heart attack, stroke, atrial fibrillation, DVT, deep venous thrombosis, heart failure, aortic dissection and rupture, uncontrolled blood pressure, heart failure incidents are more because of the patient who are already having cardiac problem. The more hospitalization occur during winter months. So one more important thing that it has been seen in one study, and I think it is a remarkable study, that those who are less than 60-year-old, they tend to have heart attack more in summers, April, May, and those more than 60, they tend to have it in winters more as compared to other seasons. So any cardiological problem which anyone is having, they tend to increase. So why they increase? So there are so many things. When the temperature is very low, so we call it vasoconstriction. That means the constriction of the arteries which supply oxygen to the whole body or organs, they tend to constrict so that the blood pressure goes up. Similarly, there are many hormonal changes. We call it catecholamines. They increase during winters. So they have their own effect in increasing blood pressure. So those who are having already blood pressure earlier controlled, it might increase. And if the blood pressure is very uncontrolled, very high, then it can lead to acute stroke, brain hemorrhage, even aortic dissection or rupture. So they are serious kind of complications that can happen. Why it happens? Number one, the temperature. I told you that it constricts the blood vessels which supply oxygen. Secondly, there is a limit of physical activity. Due to winter, the people remain inside most of the time. So that again, your physical activity has gone down, so you may have further problem. Similarly, the pollution level is high. Apart from that, the crowding is there. The crowding of people are there because when there is a very cold weather, so people try to confine in a single room or a heated room or something like that. So they can also increase the infection and leading to further incidences of heart failure hospitalization. Apart from that, the food habits also changes. The people, the human being, those who want something to eat in winters is different from what they want to eat in summer. So these things promote it. So one has to be very careful about it because the incidences of these all I have mentioned are very life-threatening situations which should be monitored, which should be diagnosed in time and treated in time. So apart from that, I also said that it has been found that seasonal variation in hormones which increases the blood pressure, and that also causes the blood vessels to constrict. So they all have a negative impact on a person, and that can lead to any cardiovascular problem which I mentioned earlier, like atrial fibrillation, stroke, heart attack, heart failure. And it has been found that most of the patients of heart failure, those who are having already heart failure, they tend to hospitalize, the number of hospitalization increase during winter. So one has to take care about their food, their physical activity, their medications, and monitoring of your blood pressure and heartbeat and everything one who is suffering from.